Hello friends, I Dr. Ashish Ratudi welcome you all once again at Divyarishi Arogyam Sansthan. Today I will tell you about a very common problem which I think many people must have faced in their life or are still suffering from it. This is called frozen shoulder. But before starting the video, if you are new at our channel, then please subscribe it and press the bell icon so that the notifications for the upcoming videos won't be missed. So if we go by the definition, then frozen shoulder means freezing of the movements of the shoulder joint. Patients present the symptoms of pain and limited range of motion of the shoulder. But here is a dilemma, that these two symptoms are actually present in many diseases of the shoulder joint. So how to elicit? Actually, clinically also, we diagnose a person with frozen shoulder by using elimination method. It means we first try to rule out the different other causes of pain and stiffness in the shoulder. An important symptom of this disease is the severity of stiffness that often make it nearly impossible to carry out the even simple arm movements, or we can say even lifting a just 1 kg box. Rotating the shoulder externally is especially affected. Now, pain due to the frozen shoulder is usually dull and aching and can happen even during the passive or the supported movement of the joint. Pain may be worse at the night also. So these were the symptoms of how to diagnose the frozen shoulder clinically. And the other way to diagnose this disease is to go for an MRI or a grayscale USG if the patient can afford it. So viewers, a question must be bothering you that how this frozen shoulder occurs. Well, don't worry about this because that's why I am here. I will try to explain this in the best layman way possible. Actually, our shoulder joint is covered by a capsule-like covering which helps in the smooth movement and provides it protection. But when an injury or a surgical intervention happens in the shoulder joint, it causes inflammation there, and later on the scar tissue develops there, which results in the thickening of that capsule covering the joint. And as a result of this whole process, pain and stiffness occurs during the movement at that particular shoulder joint. Now if we look at Ayurveda, it is referred to as avabahuk. Various factors which increase the Vata dosh in our body, especially injury to the shoulder, the wrong sleeping posture and overexposure to wind and cold temperature, they all causes avabahuk. Along with the Vata dosh, when the Kapha dosh also gets vitiated, then stiffness in the Amsa Sandhi or the shoulder joint also happens. Now look, there are various stages of this disease. Initially, people describe sharp pain at the end ranges of the motion and achy pain at the rest, which is often accompanied by sleep disturbances. After this stage, the severity of pain increases, which can last for several weeks. In the later stage, the pain gradually reduces, but stiffness still persists. And after several months to years, the shoulder recovers and the mobility is restored. Let's see now how this condition of shoulder can be treated. Home remedies can be classified into two categories. One is food and the other is physical maneuvers. In this disease, the physical maneuvers are more important than the food. There are several exercises you can do to increase the mobility of the affected shoulder joint. Number one, take any towel or any cloth or even a light rod and hold it in front of your chest but with a width that is more than that of your shoulders. A bit confused? But don't be. I will show you exactly how to do this. Okay. I am having a rod here. I will do with this one. You can do with any of the any cloth or any rod or any towel. Now slowly lift this one in front of your chest and slowly go upward. Slow, 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 then backwards, slow, slow, slowly, and this. Okay. Hold it there and bring it back. Slowly, slowly, slowly in front. So this was it. Guys, remember here, initially it can be very difficult to perform this motion in a whole range. Okay, I can do this because I am doing this for a very long time. But no issues, gradually you can increase your range of motion from front to the back. It may take several weeks to achieve this full range. And also, whenever you reach your maximum range, then hold it there for at least 5 seconds. You can perform this exercise for at least 8 to 10 times a day. And again I am telling you, don't overstretch your joint because it will harm you rather than treating your pain. Okay. Now another exercise is wall walk. Stand in front of a wall at a little less than your one arm distance and place your fingers on the wall at the shoulder level like this. Okay. Then slowly move your fingers on the wall in the upward direction. Now hold for 5 seconds at your maximum stretch position and then return back slowly. There are various asanas you can perform to get relief in the shoulder pain. One is Surya Namaskar. This asana comprises of 12 postures. This asana will help in increasing the mobility of not just your shoulder joint but of your whole body. The next asana is Gomukh asana. There will be difficulty initially in performing this asana, but you can use a small towel for this purpose. Hold one end of your towel by one hand above the head and the other end by the other hand, which is on the lower side of your back. Here also you try to hold the maximum stretch you achieve every time. Now apart from these two asanas, Trikona asana and Ustra asana are also helpful in this disorder. Now apart from these exercises, always remember, try to bathe with the warm water. If not for the whole body, then at least at the affected shoulder. Also you can use hot packs on the affected joint to get the relief. But if you feel a very severe pain sometimes, then you can use ice pack also. Ice pack will help in relieving an acute pain only. Also you have to avoid the direct contact from the cold air coming from AC and desert coolers. Also try to put some extra covering over the affected joint. So friends, along with these physical maneuvers, there are various herbs which can help in reducing the inflammation of the affected joint. These are amla, haldi and black pepper. So friends, this was a brief information about the frozen shoulder. Please like the video and share it and give your valuable comments. I will meet you soon with a very new and informative topic. Till then, be safe and be happy. Thank you.